today we want to talk about HIV. Yeah, that's what we want to talk about. And sometimes people feel like HIV is quite stale. We've been hearing a whole lot about it, but I promise you that there are some things you've not heard about.
Exactly.
That we're going to discuss about.
HIV, is, as the name implies, it's a virus that is being transmitted to an individual. The meaning of HIV is an acronym itself, and it means human immunodeficiency virus. So this is a virus that is being transmitted through contact from an infected person, and this transmission can be through body fluid. This body fluid includes during sexual intercourse, unprotected sexual intercourse, also during from mother to child transmission.
Signs and symptoms. In as much as we know that you cannot look at someone in the face and know that this person has HIV, but let's look at signs and symptoms, possible signs and symptoms that can actually occur in someone that is an indication that this person has this virus.
Okay, before someone start playing out signs and symptoms, have it in mind that the person has already or is migrating or has already arrived at the AIDS.
Okay.
HIV itself most time doesn't have signs, and HIV doesn't have signs and symptoms. It's when the person start manifesting the AIDS syndrome. That's when the signs and symptoms starts coming up.
Okay, because so that means there is actually treatment for...
Yes, there is.
Okay,
there's treatment
please
for
look
it.
into the camera as they are saying there's treatment, so that the people out there
there is treatment. So there's treatment for HIV and AIDS, please. But for now, there is no cure.
All right.
Let's correct that. There's treatment for HIV and AIDS, but for now, there is no cure.
Okay.
And if you're on treatment and you accept treatment, I guarantee you live your best life just like every other individual.
Let's look at prevention, because the maxima said it all, prevention is better than cure. So we, in as much as as care can be provided, we hope that we prevent it than to actually provide care. So what are the preventive options we have for HIV?
We have preventive options for HIV and AIDS, and the first preventive options is for you to get tested. Very important.
To know your status.
Know your status. Please and please know your status. Many individuals shy off from knowing your status. As far as you are an adult, you are sexually active, you should know your status, because that is the first step of prevention from you to acquire that infection or be exposed to it. Okay. Then another one is...
So let's talk about mother to child transmission. What are the intricacies that we need to
look
know
at
when it comes to mother to child transmission?
HIV can actually be passed from mother to child if the lady involved or the woman doesn't take care of or be on treatment early. Early detection matters. That's why every woman should know her status before intending getting pregnant. Before you have the idea of getting pregnant, know your status.
Okay.
That is one way of preventing from mother to child.
Okay.
Then if peradventure she is positive or reactive, there are treatment regimen. It doesn't mean it's not a death sentence. It's not a death sentence. Many women shy of, oh, my own is finished, my child is not a death sentence. A child can be born by a HIV positive mother, and the child comes out negative.
So if there's a lady who has HIV and maybe she has a high viral load, and maybe she's expressing breast milk, and for people who for whatever reason have a preference, adults who have a preference for a breast milk, if an adult consumes that breast milk, can the virus be passed to the adult? Hello everyone, thank you for joining us today on another episode of the Intimate Matters podcast. And on this podcast, as you know, we take you on a deep dive into the world of sexual and reproductive health, and we share with you what you need to know about your sexual and reproductive health to help you make better informed decisions, which will be very integral in your life. Your sexual and reproductive health is one aspect of your life and also your health that is very, very important, has the potential to make or mar other aspects of your life. And as usual, I'm here with a great guest, someone who has a whole lot of knowledge as it pertains to sexual and reproductive health. Nurse Antonia, thank you for joining us.
Thank you very much for having me.
Okay, so today we're going to be discussing something that has been causing quite a buzz. I think it's one thing that has been here and has been doing so much for since the 1980s, I want to say. Today we want to talk about HIV. Yeah, that's all we want to talk about. And sometimes people feel like HIV is quite stale. We've been hearing a whole lot about it, but I promise you that there's some things you've not heard about
Exactly.
that we're going to discuss about. So, Nurse Antonia here as someone who's working in the HIV programming space. And I think I'll just later to introduce herself.
Thank you very much once again for having me here. My name is Nurse Antonia Patrick Okun. I've been fortunate to work with an HIV programming organization, and I will say I have a little vast knowledge about it. And just like you said, so many misconceptions around, so many fallacy people are having about HIV and AIDS, so many of them. But I think after the end of this session today, we'll be able to explain a little better for people to understand what HIV is all about and what they should know and what they should expect.
All right. So let me just dive right into something you don't know. So when we're talking about providing care for people living with HIV, we have actually two ways. We have people we call the key population and we have the general population. I know you didn't know that. So as we go on, we're going to unravel what it means by the key population and also the general population. But let's just step right into the basics, just give an overview of HIV/AIDS, what somebody should know about HIV. Then you could also include AIDS.
HIV, as the name implies, it's a virus that is being transmitted to an individual. The meaning of HIV is an acronym itself, and it means human immunodeficiency virus. So this is a virus that is being transmitted through contact from an infected person. And this transmission can be through body fluid. This body fluid includes during sexual intercourse, unprotected sexual intercourse, also during from mother to child transmission, sharing of shafts and needles, example from those who inject drugs, and using tools, items, procedures or practices with unsterilized in needles or equipment or shafts. And also through needle pricks, that can be through occupational hazard or non-occupational hazard. Maybe you get pricked by through a needle or shafts from an infected person. So those are the mode of transmission for HIV and AIDS. And also this virus, when it gets into the system of an individual, it doesn't show, there's no symptoms at initial stage. It has incubation period that the person can move around without knowing what is wrong with him or her. You're just fine. You're still healthy. You go about your business, and it takes about 28 days to 3 months for the results to show if you carry out a test.
Okay.
And even after carrying out this test, the person can still stay for 5-10 years or more, depending on the immune system of the individual and also depending on the lifestyle of this individual. So it takes a whole lot for this virus to show or to start, the person to start having symptoms. And what this virus does in the body stream is that why it takes that long is because it attacks the T cells of the individual. It attacks the lymphocytes of the individuals, like the CD4 T cells of the individual. And it takes a lot of time because the way an individual is being made by God, we have our own immune system that fights infections or diseases. So that's why it takes that long, depending on, as I said, the lifestyle of this person.
Okay, so I just want to say, well, because you talked about the incubation period when there are no manifest symptoms. So at this incubation period, can the person who has already contacted the virus, maybe the virus is incubating in him or her, can the person pass it at that stage to the next door neighbor?
No, before the incubation, this incubation period, as I said, within 28 days to 3 months, 90 days, there's tendency that there's little chance for the person to transmit this to another person. There's a little chance. So, but it's not being ruled out.
Okay.
It's not being ruled out because the partner or the individual, as I said, the lifestyle. Now, if this person that maybe during unprotected sexual intercourse, and the partner has immunosuppressive issues, maybe already existing infections, can make the person high risk to have this infection. But why it's also like that is during this incubation period, it's being said that the virus replicates often, multiple times faster than later. So the partner may contact it, but this individual, the host, may not know that he or she has it.
Yes. The virus. And thank you so much for while you were talking about the passage through body fluids, you made mention of a couple, and it's essential that you make mention that these are especially fluids that are shed during sex, vaginal fluids, sperm, semen, and so many other fluids that we have done, sometimes blood, because oftentimes people wonder, talk about saliva, talk about sweat, that are still body fluids. But the truth is that because of the fact that we don't have much of this virus in these fluids.
Let me throw a little
so because knowledge. People ask, why is it that sweat, saliva, that are still body fluids, but we cannot have it?
Yes, it's true. HIV virus itself survive is very vulnerable. Let me use the word vulnerable. It doesn't thrive outside the body. It doesn't thrive in the saliva. It doesn't thrive in sweat outside the body. Even if it's been exposed outside the individual body, it dies easily. Yes, dies because it's not in the bloodstream. So it's not possible for someone to get it through saliva or sweat. That's where the fallacy and misconception comes in, that you see that some people say, no, I don't want to go near this person. No, I don't want to shake hands. No. That's where the stigma comes in. But no, awareness and sensitization has been made often for people to understand that you cannot get HIV and AIDS through kissing, through shaking of hands, through hugging someone, through sharing food or utensils or clothes or all. You cannot get through that.
All right. Thank you so much for putting that out there, because so many people are actually scared, leading to stigmatization of all these people. And just to say about the issue with kissing, you can't have it because you're sharing. Saliva is being shed during kissing. But if there is a wound in which blood can be transmitted, or you can pass blood from the person's mouth to the other, it's possible for that to happen because the HIV virus is found in the blood. And just as a rule of thumb, almost every virus cannot survive outside the body of the host.
Yeah.
So if it's a virus that causes disease in human, it cannot survive outside the body of human. So let's look at signs and symptoms. In as much as we know that you cannot look at someone in the face and know that this person has HIV, but let's look at signs and symptoms, possible signs and symptoms that can actually occur in someone that is an indication that this person has this virus.
Okay, before someone start playing out signs and symptoms, have it in mind that the person has already or is migrating or has already arrived at the AIDS.
Okay.
HIV itself most time doesn't have signs, and HIV doesn't have signs and symptoms. It's when the person start manifesting the AIDS syndrome. That's when the signs and symptoms starts coming up. AIDS means acquired immunodeficiency syndrome. Now this is the late part of the HIV.
Like the late
stage of the HIV.
Okay.
Now when it gets to that, the first thing, physical signs and symptoms is weight loss, unexplainable weight loss. The person will just start shedding weight. We don't understand why. No matter the treatment, no matter what he or she does, still losing weight. Diarrhea can set in. Loss of appetite can set in. At a point, swelling lymph node can set in. Lymph node will swell, can be at the neck region or the type, like armpits. Your lymph nodes of that person.
So most times you have your lymph nodes at the neck, at the armpit.
And you'll be feeling something else is wrong with you. You don't know. Then other symptoms include I said loss of appetite. I also mentioned weight loss.
So what of manifestation on the skin?
The skin, that's almost, let me say, almost stage 3. You have rashes, skin rash.
Okay.
You treat, it's not going off, it's just there. You just have skin rash. So
You can see your studio manager trying to look in.
so
It's thank you so much for putting that out, because it's essential for us to do that as at the early stages of the HIV virus.
then what happens again during the symptoms is that, in fact, the immune system of the individual falls down
And other
drastically,
things.
and it gives ways to other opportunistic infection.
Tuberculosis,
So all the signs of symptoms
pneumonia.
for many diseases will start playing. A cough, pneumonia will come in, mouth thrush can set in. So many things will start coming in, not because of the HIV itself, but because of the immune system of that person has been compromised or is being compromised, and other disease sets in.
Oh, thank you so much, because I've known HIV to be this kind of thief that comes to your house but doesn't rob you, but open your gates wide for other people to come and pick what they actually need. So at the early stages of the HIV, you are almost asymptomatic, no symptoms, but as you progress, you start to see the symptoms, especially when you do not take treatment. So let's look at treatment options, because oftentimes, I think before now, it was when somebody is diagnosed with HIV, you see people, walking in the clinic, counseling clinic, you tell someone, your test is positive, and you see the person slump, like,
it still happens, it's still,
physically lose consciousness.
The anxiety, it's not easy to tell someone you are reactive,
Okay.
and the person will just sit down and be looking at you and smiling. It's not possible. If you see an individual that does that, that means the person may have already known his or her status.
Yeah, came to do
and
confirmation.
maybe to do a confirmation, or maybe the person is just, it can also display denial stage.
Okay.
No,
Okay.
denial stage. Yes,
it's not my portion.
Yes, just start laughing. We take that medically, in the medical field, we take that maybe denial stage, because it can happen. But most time, when an individual walks into a clinic, or maybe in the community level, and you carry out HIV tests and rapid diagnostic tests for this person, and you do a confirmation, and if the person is actually the first time he or she is hearing that, there's always this mood, there's some will tell you, no, we have different stages of reaction.
Yeah.
Some will say, nurse, I think something is wrong somewhere.
Some will storm out.
Some will say, nurse, your people have come again. No, you come back. Let's reschedule. In fact, I'm going for a meeting. Some will say, no. I did this test last month. It's not no, there's something wrong somewhere. And why some will just be calm and be looking at you. And at the point that they know that you now know this person is not hearing anything again. Like, he's not understanding what you are saying again. I need to reschedule this visit. So different reactions for different persons.
Cool.
There are some that are mentally strong, and though they'll feel bad, but maybe they've already had pre-information about it, and from your counseling and everything, they will understand that it's better for me to be on treatment than for me to deny. It's expected for an individual to deny every disease, and we all know the stages of grief and all that.
Grieving.
Yes. So it's normal. It's normal for you to see many people to be at denial stage. But it's not less for you as an health worker or a community health person to be able to go back to that person and explain the need, because we owe them that. We owe them that a lot. And when you get back to them, you explain. And when that person is being placed on treatment, as a health person, you feel very fulfilled, that you have saved a life.
Okay.
Because
so that means there is actually treatment for...
Yes, there is. There's treatment for...
Please look into the camera as they are saying there's treatment, so that the people out there...
No, there is treatment. So there's treatment for HIV and AIDS, please. But for now, there is no cure.
All right.
Let's correct that. There's treatment for HIV and AIDS, but for now, there is no cure.
Okay.
And if you're on treatment and if you accept treatment, I guarantee you live your best life just like every other individual.
Okay. So thank you so much for putting that out. And I think we owe it to our fans, because we've mentioned the stages of grieving. So we have like 5 stages of grieving, and we call it DABDA, DABDA, where we have the first stage is the denial, where oftentimes you see when a health condition is being, when a diagnosis of a health condition is being given to someone, the person denies it, says it's not my result. The next stage is the anger. They become very angry.
Aggressive.
So they go back home, they become frustrated, they do what they want. Then at the
refuse
third
to
stage, they
talk.
start to bargain.
No,
God,
I
why-
think it's lesser.
Yeah, God, why me?
No.
Why didn't you do it to my village people?
Yes. Oh God, I think it's a lesser symptom. It's a
Yeah.
lesser disease.
Yeah,
I prefer you would have given me this one than this one.
Okay, so after that, they get into what we call depression. It's more like a low state of
At
mind.
that point, they'll start accepting.
Yeah,
and they start
slowly.
being depressed.
Slowly, they start getting depressed, and then finally comes the last stage, which is acceptance.
Acceptance.
And we try as much as we can to get people across the spectrum of stages so that they get to the acceptance.
And not to stop at a particular
At a
stage.
particular point,
Let
so that
them reach this last one, because when they get to the acceptance, that
they
is when you
start to
know that
take
yes,
treatment.
this person is going to listen to whatever options he or she has. But when it stops at grieving or any of the other stage, it's hard.
All right. Okay. So let's look at prevention, because the maxima said it all. Prevention is better than cure. So we, in as much as as care can be provided, we hope that we prevent it than to actually provide care. So what are the preventive options we have for HIV?
We have preventive options for HIV and AIDS. And the first preventive options is for you to get tested. Very important.
To know your status.
Know your status. Please and please know your status. Many individuals shy off from knowing your status. As far as you are an adult, you are sexually active, you should know your status, because that is a first step of prevention. Prevention from you to acquire that infection or be exposed to it.
Okay.
Then another one is PrEP.
Okay.
Being on PrEP. Now PrEP is pre-exposure exposed prophylaxis.
Exposure prophylaxis.
Yes.
Okay.
It's a antiretroviral treatment for HIV negative people.
Okay.
You have to be HIV negative
to undergo that treatment.
for you to be on PrEP. That's the first eligibility.
Okay.
Then also, maybe if you know that you have encountered risk behavior of HIV exposure. Risk behavior means
you are doing things that may expose you to the virus.
Yes, maybe unprotected sex without condom breakage,
sharing needles, sharing
KPs.
sharps. Yeah,
we mentioned KPs. We'll explain better about that. KPs and sharing sharps. Those who inject drugs, sharing sharps with your partners and sharing drug fluid with your partners. That person's supposed to be on PrEP. Now, PrEP regimen here in our country, we have the one that's readily available, and which is the tenofovir-lamivudine combination. Mm-hmm. So when you be on it, it takes about depending on your kind of sexual orientation or sexual
sexual orientation.
Racial orientation.
If you're doing sex per vagina
yes,
or sex per anus.
exactly.
Yeah.
If you are doing that, so it takes 7 days, between 7 days to 21 days or 28 days to start having effects in your bloodstream.
Okay.
So it's not that when you take the PrEP now, it's okay. I have something. I have a mission. I have a meeting to attend. So let me take PrEP now. And you now move. No, it's not done like that. You have to be on it for it to have effects and act on what it's supposed to act. Now, what this PrEP does is that it prevents you or prevent an individual when exposed, before exposure.
Okay.
Now, PrEP is before you are exposed to HIV.
Okay. So you take it before you go, in case
it happens.
Okay.
Because you don't know.
Okay.
You can't predict anybody.
Especially if you hit around.
If you play meeting, go attend meeting different places. So you take PrEP. You understand? So when you take it, you can be on it for as long as.
Okay.
You just take it once daily. For as long as
you are exposed.
Yes, for you, the person you will know, for as long as you are exposed. And it has a very high chances for you not getting infected.
Okay.
It has about 97%
chance of you not getting.
if you practice vaginal sexual intercourse, and it has 79% if you practice anal intercourse. So it's very, very important for everyone to be on PrEP. If you know you're eligible for it, if you know that you don't know your partner status, if you know that you're HIV negative, if you know that you don't practice the use of condom with your partner, if you know that your partner doesn't have only you, like you can't vouch that, okay, I'm the only one, and because you and your partner may practice safe sex,
but your partner is not practicing
safe
with
sex,
someone.
yeah, because he may feel you are the main G, and you too, you feel
he's the main
G. So now, okay, let me just go and do other meetings, side meetings and all that. So when you see yourself, all these people are the eligible people that should be on PrEP.
Okay.
Now let's explain PEP.
Okay.
Now PEP is post-exposure prophylaxis. This is after you feel you have been exposed to the HIV virus. So there's a difference. And the first thing how you can be eligible for PEP is you have to do your test. The rapid diagnostic test should be done immediately on you. And when the result comes out negative, then you will be placed on PEP. And mind you, have to make sure you are on PEP within 72 hours.
Within 3 days.
Exactly. Within 72 hours, that's 3 days.
Yeah, and it's also the earlier the better, right?
Every hour counts. Every hour counts. Every hour, the chances is going higher. So wherever you are, don't say, okay, maybe even if you have done the rapid test now and it's negative, it's okay, I'm negative, let me wait. Every hour counts, especially if you know that you have been exposed to HIV virus. So you find out a place to go to, maybe a health facility or a hospital, and get placed on PEP immediately for 30 days. So once you're placed on PEP, the chances of you getting infected is so low, 99%.
Oh.
Like 99%
protection against
HIV. Yes, 99%. Only 1%, which is normal. So when you are on PEP, you will not be able to get infected. And please, 72 hours, because most people will stay off and wait till maybe 1 week, and they will now go and take the PEP and say, right, so they gave me that drug. They say 30 days. And no. It's not right. 72 hours, because every hour counts.
7 and 2 hours.
Yes, 3 days. Every hour counts. So the faster you are, the better. Then those that should be on PEP, if maybe assault,
people who have been
sexually assaulted, and you don't know the person's status, and needle prick. It could be occupational workplace hazard.
Yeah, like us when we are in the hospital.
Like us when we were in the hospital. Like, I think I've had that experience before. It was quite scary.
Almost every health professional.
Yeah, it was quite scary. Yeah, it was quite scary. I had that experience before, so I think it will never happen again. I learned very hard. So, and people inject drugs.
Okay.
Yes, people inject drugs. They don't know their partner status and all that. But don't be on PEP for a long time. Now, if you know that you are someone that's exposed to it frequently, what you should do is you go the other way. After you have been on PEP and after 3 months, you're being ruled out to be still negative, you be on
switch
PrEP.
to PrEP. All right.
Exactly.
Thank you so much for taking our time to point out that, because oftentimes when you tell people about this prophylaxis for HIV, a prophylaxis is actually a drug you take so that you can prevent yourself from having a particular disease. I know she did not mention it, but I'm a huge fan of this one as a form of prevention. Abstinence. Stay away from this thing if you know you do not have business
very
with this
important.
thing. Stay away from sex if you know that you don't have business with sex. And thank God she's mentioned condom. PrEP only comes when there was no condom or there is an error in condom, slippage, breakage, which often happens. Some people, when the condom break, they rush to prevent pregnancy.
No.
And leave this one.
No.
And leave this one.
Also, let me mention that when you are on PrEP, it doesn't mean that you are 100% safe. Like, I'm not going to acquire any infection or disease. You can still use condom.
Okay, because PrEP only prevents against
HIV.
Not other
STIs. Not other STIs. Unwanted pregnancy could come in, syphilis could set in, gonorrhea and all that. And when an individual has all this, like maybe get infected by one of these, the tendency of you getting infected with HIV increases.
All right. So I think for those who's been on our podcast, if you've not been, we have a previous episode on STIs. You go there and you learn about STI. this prophylaxis is essential to know that it's only for HIV. It doesn't protect you against other forms of sexually transmitted infection. It's very, very essential that you actually realize this. So for the KP we've been mentioning, we're talking about key population. That's how we call a certain group of people in the course of HIV programming. This set of people are men who have sex with men, or people who have anal sex. And these are the kind of people that we provide this care for. And like she had mentioned, there is a difference in their care, right? There's a difference in their care because the protection it gives may not be the same as it gives for people that have sex through the vagina. I think something I want to point out is that when people want to take PrEP, they think that they can just keep taking it. So it's essential that for PrEP, if you know you'll be exposed, you try to take it like 7 days before your first exposure so that it provides like a backup protection.
Yes, from 7
days. And then after your last exposure, you need to take it for 28 days more. But if you're having sex via the anus, you can take it for like 3 days before exposure and you keep taking it. And when we say you keep taking it, even as you are exposed, you still keep taking it. The same thing also for PrEP. You keep at it essential. And the good news is that these medications are free.
Yes,
they are. In Nigeria, they're free. You walk into any general hospital, look for their HIV clinic, and then you can get this. So let's look at some other thing, which I've seen these on social media a whole lot. Where I remember one skit I saw, a lady came out and somebody was interviewing her and was like, "What do you want?" She's like, "I need a husband." What's the issue? HIV positive.
Okay.
So we know the stigma that comes around people that live with HIV, especially as it pertains to forming relationship, most especially long-term relationship, like in the context of marriage. So let's look at, because oftentimes the fear is, if you have it, we know, like you mentioned, it can be passed from mother to child. So let's talk about mother to child transmission. What are the intricacies that we need to
look
know
at
when it comes to mother to child transmission?
HIV can actually be passed from mother to child if the lady involved or the woman doesn't take care of or be on treatment early. Early detection matters. That's why every woman should know her status before intending getting pregnant. Before you have the idea of getting pregnant, know your status.
Okay.
That is one way of preventing from mother to child.
Okay.
Then if peradventure she's positive or reactive, their treatment regimen. It doesn't mean it's not a death sentence. It's not a death sentence. Many women shy of, oh, my own is finished, my child, is not a death sentence. A child can be born by a HIV positive mother and the child comes out negative. A woman that is HIV positive can get married to a man that is HIV negative and will live happily, and the man will remain negative and nothing will happen. And they'll still have unprotected sex and have children that are negative and nothing happens. It all depends on, are you ready to follow the treatment regimen? Are you ready to abide by the rules and treatment regimen? Once you do all that, I've seen so many couples. I have zero discordant couples I'm taking care of.
Okay.
So many of them, and they're living very well and they're living very happy. Okay. I've seen a woman that is 72 years and reactive and she's fine, very healthy. So it's just for you to abide by everything. Now, for a woman that is pregnant, let's go back there. The woman that is pregnant and she realized that she's pregnant. HIV treatments, as HIV drugs doesn't have effects on unborn children.
Okay.
It's very safe during pregnancy. So there's no reason why a lady that is pregnant and she knows she's reactive
shouldn't be on HIV treatment,
antiretroviral drugs. Yes, she should be on it because it doesn't have any effects on the baby.
Okay.
As far as scientifically, to the best of our knowledge, through research, it does not. So when the lady takes this medication, it acts as a barrier. Now, the viral load of this lady will be low. The viral load is the amount of the virus in your bloodstream. So the viral load is quite low to a point that it could be non-detectable when viral load test is being done.
Okay.
And when that is when it reaches that stage, the baby cannot have it in utero. Now, another way the baby could be exposed is during delivery.
Okay.
If the viral load of this the woman is low, is high, very high, let me say more than 1,000 copies per mil, and the vaginal delivery is the option here. Probably they may even deliver at the TBA, where sterile procedures are not really being put in place. The baby is exposed.
Okay.
Through breast milk too, the baby could be exposed. When the viral load is just as far as the lady is not on treatment and the viral load is quite high.
So you're saying that if the lady is on treatment and has a low viral load, that either in utero, through delivery, through breast milk, she cannot pass
she
the
can't.
virus.
Once you're on treatment, she can't pass the tendency of a child getting infected is quite low. So at 98%. 98, 99%. There is only 1% chance.
Okay. So something just piqued my interest because you mentioned breast milk. So if there's a lady who has HIV and maybe she has a high viral load and maybe she's expressing breast milk, and for people who for whatever reason have a preference, adult who have a preference for a breast milk, if an adult consumes that breast milk, can the virus be passed to the adult?
No, for research has proven that for an adult, the virus cannot be passed to that adult.
Through breast milk?
Through breast milk. It can't because first it acts on the saliva.
Oh, okay.
You know, a baby, the salivary gland,
the immune system is still very fragile.
Yeah, very fragile. It's still banking on the mother's antibodies for a child. But for an adult, it already has a strong immune tendency. I
have a very strong urge that there is somebody who will be listening to this and will be smiling on. I'll be smiling at
but that doesn't mean that we should all go around to do that. It's just a research.
If it was exposed,
it's just a research. It doesn't mean that you may be that rare individual. It's just a research.
Okay.
So another thing I want to explain again is for mother to child transmission. Another option that the woman may have to prevent exposure is elective CS. If the lady didn't know that she has the virus and probably comes to know at the end,
at the third end of the pregnancy,
she can opt for elective CS. It's
minimizes the
risk of the transmission to the baby.
All right. So it's essential that pregnant women out. I think that's why HIV test is like one of the most integral tests when you step into antenatal clinic.
Yes, it's they can't rule it out.
Go to antenatal clinic.
So every pregnant woman should endeavor to go to antenatal
clinic. This is why we say go there. It's not
just for TT.
Yeah, I know that you have somebody in your village that has been, delivering women for 500 years. We know, but please go here. These are the kind of things that they need to check out. So
when they go for antenatal, they should not just stop at the antenatal. Because most women go for antenatal. They already start. Why? Because in their subconscious mind, they want to just go for the tetanus vaccine, know. And when it's time for delivery, they opt for where it's convenient for them. Go for antenatal and also deliver in the hospital.
Okay, so they say I should rephrase it. Go, stay, and finish your antenatal appointments and clinics because it's quite essential. And like she had actually said about mother to child transmission, it shouldn't be an issue why you should stop, getting into a long-term relationship with somebody living with HIV. There've been researches, there've been things that have been done, drugs have been developed and formulated, which will help to ensure that it doesn't pass from the mother to the child. No child should come into this world to suffer and have a disease that.
And when this child is born, have a one-on-one interaction with your healthcare provider as much as possible, because there are steps you have to follow. When this child is born, before this child is born, you'll be told that this child should be on medication. When this child is born, there's a medication that they have to place this child on for at least for the next 6 weeks.
That falls back again to hospital.
So that's the reason why, if you know your status and you are reactive, you should not get care from the community or TBA. You should go to the hospital, not just bedding a child. So that at the end of the day, your child will stay alive for you, because there are tests that should be done for this child till 18 months. So that they can rule out completely that this child is safe. from it.
So it's essential that you do that, and also please, like I had contributed in that social media post I told you about. I told the person that it's possible for you to attain what is called U is equals to U when it comes to HIV treatment. I know you might be wondering how I know this. This comes from having spent some years working in an HIV treatment program. I think it was some of my most fabulous years, knowing that the thing you're doing is actually touching people out there.
Yeah.
So when you get to U equals U, which means that undetectable is equals to untransmissible, that you can go through your treatment regimen and the viral load in your blood is so reduced
that's become undetectable.
Yes, it cannot be detected by test kit. And at this level, you cannot transmit it to the next person. So she mentioned serodiscordant couple, meaning that one person may live with the virus, the other person does not have. You can stay together, have children, have sex, and you do not have this virus. So it's essential that if you see somebody that satisfies your
every other attributes. It's quite scary, It's quite scary for an individual. No, maybe the person satisfies other attributes,
but it's
just this one, it's scary. If you really want to look at the scenario, it is. But we want to, I want to emphasize or reassure now that it's not a death sentence. It's not something you should be scared about, because as far as your partner is on treatment and the viral load is less than 200 copies to a point of being undetectable, you cannot transmit it.
All right. So
we are all safe.
Okay, everyone is safe. And it's also good to ensure that when you get to that stage, please keep to that treatment regimen so that you can stay
because we have seen
most people, when they get there, they feel that they call it a cure in quotes.
Yes, they call it a miracle.
Yeah.
Miracle from God. we do mention this when we are giving counseling, the pre-counseling, because it happens. The miracle from God, when you go and do the test, the rapid
and it's
test.
Not detected.
Yes, because it's so low. And so thank God, I'm free. I'm so free. I thank God. So some people tend the miracle from God. We always explain, please, even if it's undetectable, continue with your regimen, because at this point in time, you are a warrior. You are HIV warrior. You can stand high and counsel others that I have done it. You too, you can. So you don't feel I'm fine, or your part, or what your religious person says, you're okay, you are healed, and you go home. Because when it wants to bounce back, when you stop and the virus replicates again, when it's before you know what is happening, that person
like the holy book, like my holy book will say that your end may be worse than your beginning.
Yeah.
So thank you so much, Nurse Antonia, for giving us this wealth of information. These are information that people out there do not know. So just like your parting shots, I want you to give your parting shots in line with talking about people that provide care, because that's also one of the issue. There have been complaints on the attitude of people that provide this form of care, since it's something that is sexually inclined. So what can you advise people that give care to ensure that, people want to come out to get tested, want to come out to, adhere to this medication? So give your parting shot and also an advice to the people that provide this care.
For us that are health workers and health personnel, we should, first of all, you shouldn't stigmatize. It should not be in your book. Every patient that comes to us for any test or any counseling or any investigation, it's a bonus, because that particular person can help you help another person. Like HIV and AIDS, if you test this person and the person is positive, you can link to the person's partner, which the person may not know, the partner may not know, and the partner will be tested and placed on the required treatment. You have also saved another person. So there should not be stigmatization for any reason. Love and care, holistic care. Welcome this person. Don't judge, because HIV and AIDS, gone are the days that we used to think that HIV and AIDS is transmitted through only sexual intercourse. It's not. We have blood transfusion and the rest of it. So don't draw the conclusion that immediately the person comes as an individual. Because before we are health persons, we are individual. So by default, it may want to click. You not draw the conclusion, this person has gone and all that. Not only that, it may even be one partner that may have just gone and borrow it from somewhere and come and dash this person over here. Then another thing again we should have in mind as health worker is treatment availability. We shouldn't deny anybody treatments, especially if you see yourself working in that particular unit. If you are not in that particular unit, do appropriate referral.
Okay.
Don't be reluctant to refer someone or say, let that person, even if the person is in the denial stage, it's our duty to follow up on that person.
Okay.
Because it's normal. Don't let the person go. So you have to, it's you now and all that. Follow up the person. Bring in other people that you feel the person may listen, that yes, can improve adherence counseling and all that. So we should always have it in mind that remember why we are in this field. Apart from leave HIV and AIDS, every other care as far as clients, patients is involved. We should not stigmatize the person.
All right.
We should make sure that this person feel welcomed. Because so many people, I've met people that say, I'm not going there again because they're always making me feel unwelcomed.
All right. So that is essential, especially for health professionals, that you put out there and you know that it's your job to do this and you're there to provide care to these people and you need to provide. And also as health professionals, we are at risk of being exposed to this virus by virtue of what we do.
Sometimes we should all be careful.
Yeah, we should be
while we are carrying out our work. Care. Yes, we should.
We come in contact with blood, sharps, accidents, and the rest. And it's also important that we have this knowledge. If you are exposed, go get your treatment. So, and thank you so much, Nurse Antonia, for joining us. And thank you so much for everyone who is viewing out there. That is why we are here on the Intimate Matters podcast. We talk to you about things like this. We interact with you about things like this that pertains to your sexual and reproductive health. We'll do well to connect with us on our social media platforms. We are on TikTok. We are on Instagram. We are on Facebook. Also, our personal WhatsApp page where we get a chance to interact with our fans and our followers, and we can answer your questions if you have any personal question, and you can ask your questions on the comment section. Please do not forget to like, subscribe, and share these videos. Share these to your church WhatsApp group. Share these to your village WhatsApp group. Share these even with your enemies, because like I usually say, your enemy needs to stay alive to see you prosper. So we're so much grateful. Thank you, Nurse Antonia, once again for joining us. And as usual, I am your anchor on this podcast. My name is Nurse Akwaowo Akpan. They call me the Gig Nurse. And it's my pleasure to take you on this journey. And until we see you again on the next episode, we will have another interesting topic to discuss with you. Remember that your intimacy matters. That is why we have the Intimate Matters podcast. This is bye for now. Thank you.